Your host, and we're going to be talking as part of our Vision Care series this evening to Dr. J. Rex Parent. He is a common guest here on the program. We really appreciate him being here, but we're going to be talking about refractive options, and we'll also open up the phone lines throughout the entire program for any other eye concerns that you might have. And the number is on your screen. Locally, it's 969-2720, or toll-free long distance. We'll pay the bill, 866-969-2720. Dr. Parent, thank you so much for being here tonight.
Thank you very much. We're happy to be here.
Well, we're going to be talking mainly about refractive options, and I know we've talked about that probably several times on the program, but when we talk about or mention refractive options, what does that exactly mean?
Refractive options means the ability to change one's need for glasses or contact lenses and improve their vision without glasses or contact lenses. There's several options, and probably the most famous, or the one everybody talks about, is LASIK. They've heard of LASIK. People sometimes mix it up with the medication LASIX, and LASIX is a medication for heart failure to run water off the body. But LASIK is laser-assisted in situ keratomelusis. You mentioned that to me earlier, I think.
Right, yeah, exactly. and there are more than just one type of LASIK.
Exactly. When LASIK started, we actually just took a laser and reshaped the cornea in the same way for everybody. But there's now custom LASIK, and I think if we can put up maybe the first picture we have, actual LASIK now involves making a flap in the cornea, as the left side of that picture shows, and then after we make the flap, we lift that flap, and we can go to the second graphic, please. If you look to the right side, the red beam is the actual laser which reshapes the cornea. It's just like putting a contact lens inside the cornea. Very similar to that. And then we can go to the next. Then we lay the flap back down, and the final one, and we can correct the refractive error. And what happens is, nearsighted people, their eye's too long, and the light falls in front of the retina. Where farsighted people, their eye's too short, and the light actually would fall behind the retina. So that's what we try to correct with LASIK. We also try to correct astigmatism, which I'll talk about shortly, but you asked specifically, there's different types of LASIK. The original LASIK we did, and I started to do years ago. I actually went to Brazil to do it because it was not approved here yet.
And you're one of the pioneers in this, sir.
Well, we did it real early. Yeah, I didn't pioneer the technique, but I did it very early. We were an acceptor real early, and we've done it for years and years. As I said, I did it before it was even legal in the United States, but in Brazil and a couple other countries. LASIK itself has the plain laser you use that makes the regular shape, just reshapes it like a contact. Then there's custom LASIK, and we can possibly look at number 5 graphic. And custom LASIK, we take a special instrument called Xioptics Diagnostic System, and that instrument actually finds small irregularities in the eye. And by finding those small irregularities in the eye, it helps correct those. So many people tell us after they've had custom LASIK that they literally see better than they ever saw either with glasses or contact lenses, which give you that regular shape other than the exact shape that matches your eye. And if we look at number 6, graphic number 6, that shows how your cornea, or the clear front window of your eye, and the actual path, your visual pathway back, has different irregularities. Like the center of that one picture is kind of a hot orange, and that area has a different shape, and the different colors mean that they have different shapes. So you can actually have a custom correction for these individuals. So it's just an interesting thing that we can help people like we never could, because we can track the visual system all the way back to the retina, through the lens, and all the way back. And with those individuals, we can help them. Many people say, you know, I just see better at night and better at other times than I could ever see, either with my contacts or with my glasses. So it's a big benefit for a lot of people.
Yeah, I've heard a lot of people just rave about it, and we've had some testimonial patients on the program before. If you're just tuning in, we're talking to Dr. J. Rex Parent, an ophthalmologist and eye surgeon, Fort Wayne based, and we're specifically talking about refractive options tonight. Of course, if you have any other questions about eye concerns, the numbers are on your screen. Talking about LASIK surgery to start things off in the program, who would be a good candidate, and what are the parameters of whether or not you can have LASIK surgery?
Well, specifically, individuals need to be over 18 years of age, and we really like them to be over 21. You need to stop growing, and the reason you need to stop growing is many people's eyes will elongate as they grow, and your refractive error needs to not change. So in other words, if you say, well, my glasses are changing every year or every 6 months or every year and a half, having LASIK to correct that original prescription won't be beneficial because your eye's changing. And therefore, we want a stable refractive error in people. Some people that have a real high amount of nearsightedness or a high amount of farsightedness are not candidates for LASIK, because LASIK can thin your cornea enough that your cornea actually pooches out or stretches out in the middle, and that gives you visual problems where it continually moves and gives you corneal irregularity. And farsighted people, most farsighted people don't realize they're farsighted until they're about 40 or 45. And that's when the next option comes in, and possibly we can just look at number 7, graphic number 7. And that option is a growing option, and fortunately I was one of the first people to adapt to multifocal lenses, and years ago I found that if you take people that are farsighted and you replace their lens in their eye with what's called a multifocal lens, those individuals then are able to see at distance and near. And farsighted people start having trouble when they're moderately farsighted in their 40s. Most people are wearing bifocals by about the time they're 45. And the only way to correct your glasses for distance and near is to actually replace their lens. So if we can go back to 7 again, please.
Now, are we talking about refractive lens exchange in this particular situation? Okay.
Absolutely.
All right.
And if you look, we remove the lens, which if it becomes cloudy is called a cataract. So a cloudy lens is a cataract. We remove the lens with ultrasound. If you see that picture, we go through a tiny incision anywhere from 1.8 to 3 millimeters in size. And we use this vibrating ultrasonic tip to remove the lens. Then if you look at number 8, we replace that lens with a special lens, like having a bifocal inside your eye, so that you can see at distance and near with that specific lens. We correct your nearsightedness, farsightedness, and allow you to have a bifocal in your eye. So those people that are that age and want that done are usually it's in many cases nearly a lifetime fix.
Let's take a look at graphic number 8.
Yes.
I think they probably have that staged and ready to go by now. This is the intraocular lens implant.
That's correct.
And you can see the edges there. Yes. Those are what actually lock in the cornea. Is that correct?
That's what locks in the capsule.
The capsule.
Yeah, you go through the cornea, remove the lens, and the lens is surrounded like a baggie-like or saran wrap. And this, if you take that specific lens, it's foldable. So you fold it up and the arms open like a butterfly opening its wings in that capsule, which has no blood vessels. And by having no blood vessels in the capsule, you don't have an immune response. So these people do extremely well. Nothing in any surgery is 100%.
Right.
But it is a tremendous benefit for people, particularly when they're 40, 45 years old and they're trying to use glasses less. Those individuals, in many cases, certainly over half the cases, just never wear glasses again.
All right.
Distance or near.
Very good.